Welcome to another Puscast. This is covering the first 15 days of December 2012. I think I got, 5 days before the end of the world? So you better hurry up and learn something. Time is running out. This is brought to you by Pusware LLC, my growing multimedia empire, over at edgydoc.com, where you will find links to my blogs, my podcasts, my books, and my apps. So I've been giving talks for 30 years, and I've noticed that if you make jokes about, say, Democrats, they laugh and nothing happens. If you make jokes about Republicans, well, they complain. And if you make jokes about libertarians, they come up later and proselytize you. Let me tell you, don't ever make jokes about libertarians. There's a humorless bunch. But conservatives are routinely ready to whine and complain because they're thin-skinned, whiny babies. Well, maybe not all of them, but I got a recent review on iTunes that, quote, wonderful opportunity to educate squandered by the juvenile, hateful left-wing extremism of the author. Grow up. So this is a warning. If you don't like a juvenile, hateful left-wing extremism from someone who is never going to grow up, my motto being, you're only young once, but you can be immature all your life. But if you don't like that sort of thing, this may not be your podcast. But let's move on to the literature, shall we? I always didn't like West Side Story. I don't know. They had these two gangs named the Bacteroidettes and the Firmicutes. No, wait, those are anaerobes. I've talked in the past about how the microbiome may be associated with obesity. Of course, association is not causation. And there are some interesting studies that show that if you have a decreased number of Bacteroidettes, if that's how you pronounce it, and that you don't have the right number of firmicutes, Firmicutes, then you're more likely to be obese. This looked at this issue in children and found yet another study to show an association between reduced gut Bacteroidettes, I don't know how you pronounce it, and an abnormal ratio between the Bacteroidettes and the Firmicutes, however you pronounce it, is associated with obesity in children aged 7 to 13. There are several other studies that have shown this association, and curiously, if you get vancomycin for your endocarditis instead of a beta-lactam, you're more likely to pack on 20 pounds, perhaps due to the messing of vancomycin with your gut microbiome. I really need to go into business selling these organisms as probiotics as part of a weight loss plan. I'll make a fortune. You get what you pay for. This podcast is proof enough of that. But in North Carolina, they're having a problem with illegal tattoos being complicated by MRSA infections. As they state so clearly, quote, the situation is complicated by illegal tattoo artists offering less expensive artwork as their bargain prices often involve stinting on sterile technique, end of quote. I know you youngsters in the audience may be considering a tattoo. Please go get it done by a professional. Besides Staph aureus, there's atypical mycobacterium, hepatitis C, hepatitis B, and even potentially HIV. Not worth a tat. But then it's sort of a marker of my age. Nothing is worth a tattoo. And now a hodgepodge of infection control issues that I think are of note. One, hospital privacy curtains. They are often colonized with bacteria and become that way rapidly. They found that 92% of curtains had contamination within a week after being placed. It included staph, MRSA, Enterococcus, VRE, and aerobic gram-negative rods. As disgusting as it is, everything is colonized with horrible bacteria. And if you foam your damn hands, which so many people seem loath to do, it probably won't be much of a problem. And maybe more than just your hands. This looked at the predictors of stethoscope disinfection among pediatric healthcare providers, and none of them did. Not too unsurprisingly. I'm now in the habit of I foam when I walk in the room, I foam when I examine the patient, I foam after the patient where I foam my stethoscope, and then I foam when I go out of the room. So my habit is to foam 4 times per each patient. Fortunately, I don't get dermatitis from the foaming. And the study had the common finding. 76% thought you could transmit infection by way of the stethoscope, but 24% reported disinfecting their stethoscope, which is typical. I often say, well, what percentage of hospital-acquired infections come from the hands? And people say, 80, 90%. That's maybe ballpark around 40%. But people never behave like they think their hands or their stethoscopes have the potential to spread infection. Acinetobacters may be resistant to terminal cleaning. I always think I should say terminal cleaning like Arnold Schwarzenegger as a Terminator. But they looked at before and after cultures of the environment in a patient who had an MDRO Acinetobacter and found that it was still in the environment even after what was hopefully a appropriate terminal cleaning. While they do note that the cleaners were not monitored to make sure they did proper isolation, they still could find in some patients the Acinetobacter at hand. So I suppose now I should say I'll be back, like Arnold Schwarzenegger in the Terminator movie, but I'll spare you my pathetic attempts at impersonations. And finally, if you put people in contact isolation, people don't get quite as good of care. That's no surprise. That's been shown with tuberculosis isolation. But if you have patients in isolation, people don't walk into the room as often. With patients in isolation being seen on average 2.78 visits per hour versus 4.37 visits per hour for those not in isolation. They also spent less time in the room, 13.98 minutes. That's precision, versus 16.98 minutes. They're timing those visits like an Olympic swimming meet. And here's what's truly profoundly pathetic about this particular study. The real take-home is to not go into the hospitals of the University of Maryland Medical Center and their associated VAs. Here is the quote. Healthcare workers are not significantly more likely to perform hand hygiene upon entry to a room for patients on contact precautions, 42.5%, than with other patients, 30%. On exiting the room, a patient on contact precautions, however, healthcare workers maintained hand hygiene 63.2%. That's what you call a D, compared to 47.4% with other patients. Goodness gracious, great balls of fire, don't send me to those ICUs. Jesus. How infectious is hepatitis C? Now, this is not the definitive study, but an interesting one. I say it's not definitive because, as all transmission/epidemiologic studies do have confounding issues that are difficult to control for. This study looked at the risk of discordant transmission of hepatitis C among monogamous heterosexual couples. They found that the risk of spreading hepatitis C was about 0.07% per year, and they figure that comes down to about 1 transmission per 190,000 sexual contacts. They also found that no specific sexual practice was associated with hepatitis C positivity. I have read higher numbers than this in the past. This makes it not a very infectious disease, at least sexually. There is regional variation in susceptibilities of organisms to antibiotics. This is really true of mycoplasma. In the United States, for example, macrolide resistance is only about 8%. In France, it's 10%. In Italy, it's 26%. In Israel, it's 32%. In China and Japan, 80% or more of Mycoplasma pneumoniae are resistant to macrolides. So what is the best therapy? This looked at the comparison between a doxycycline versus levofloxacin and found that doxycycline got the kids better faster, they defervesced, and had a more rapid decline in the number of organisms by PCR in the airway. Now, this is a self-limited disease in most people, but if you decide to treat a mycoplasma pneumonia, especially somebody who's recently coming back from, say, China or Japan, maybe a macrolide would not be the best way to go. Although I like to think I live in urban Portland, on my walk I often go by a field of sheep. I always hold my breath, not because they smell bad, they do. But the concern is always Q fever. I don't really hold my breath when I walk by the sheep. And I tend to think of Q fever as being associated with isolated cases after exposure to a sheep or goats. The Netherlands has been Q fever central for the last several years. They had an outbreak that started in a goat farm, a dairy goat farm to be specific, and they had a huge amount of Q fever as a consequence. They estimate that this particular goat farm was responsible for almost 9,000 infections, and that the Q fever spread as aerosol at high rates within 1 kilometer of the farm, 6.3% of people infected, but it went as far as 4 to 5 kilometers where 0.1% of people became infected. For those of you that don't do metric, 1 kilometer equals about 5 furlongs. So it was spread at least 25 furlongs and beyond. The take home is if you see an index case of Q fever, start looking for other associated cases, especially if it's associated with a goat farm. And there was that hyper spreader of a sheep in Germany a couple years ago, reported in Emerging Infectious Diseases. I hope they don't have pet therapy sheep anytime in the hospital. At my institutions, we have started using an alcohol-impregnated cap on all our central lines to help decrease line infection rates. Not everyone can be fastidious about scrubbing the hub. And a recent study showed that there is good benefit. In this oncology unit, their infection rates declined dramatically compared with historical controls. They went from 2.3 per 1,000 catheter days down to 0.3 infections per 1,000 catheter days, which is pretty good. But more interesting is that the contaminated blood culture rates went down from about 2.5% to 0.2%, which would have a significant cost savings over and above what you would expect from decreasing line infections. Contaminated blood cultures cost the system a mint. I think it's a peppermint, not a spearmint. But I did not expect to see that you'd also decrease your contaminated blood cultures as a consequence of using central lines. I have all these sort of standard jokes, like, unlike love, MRSA is forever. Sometimes I say herpes is forever. Or perhaps I would have said VRE is forever until I saw this study that looked at how long patients are colonized with VRE after they acquire it in the hospital. The mean duration is only 5.5 weeks after discharge. And 90% of people are cleared by 25 weeks, which is pretty good. Those who are not cleared include dialysis patients, surgical patients, and patients on antibiotics. And of course, anyone who goes to a nursing home. But about 3 months after discharge, most patients, at least in this study, were VRE free. One would wonder if they were still there in very small numbers and just not seen, but it's a good starting point. A bunch of pneumonia-related articles out. One was it suggested that patients who are on benzodiazepines have an increased risk of community-acquired pneumonia and subsequently dying of said pneumonia compared to those who don't take benzodiazepines. They hypothesize that this is due to the immunologic effects of benzodiazepines and their immunosuppressive effects. I don't think so, but we'll see. I say that because there are 2 other articles out this month. Both looking at the impact of aspiration pneumonia on outcomes. And I don't know about you, but I've noticed that patients who take benzos tend to be a little bit decreased in their mental status. Maybe they're, aspirating. But these looked at the effects of aspiration on outcome and found for both community-acquired pneumonia and hospital-acquired pneumonia, if you develop an aspiration pneumonia, you are more likely to have an increase in your 30-day mortality. So I'm betting benzodiazepines make you get more pneumonias and die because they make you wonky, not because they're messing with your immune system. Of course, I still have an affinity for immunomodulating drugs of all kinds, and maybe benzos will play out. Color me a wee bit skeptical, which is a slight off-color blue. I have mentioned before there were things that mark me as old. I don't get tattoos. The square black glasses that seem to be de rigueur but look hideous on everybody. And I just can't bring myself to give steroids to acute infections, although there is interesting data on the topic. This was a meta-analysis, never my favorite, that looked at all the studies that looked at adjunctive steroids for pneumonia and found some benefit, mostly in length of stay, but did not, fortunately, alter mortality. So beat on the inflammation, they get out the hospital a little bit sooner. We had grand rounds recently on the use of steroids for infectious diseases, and I have to admit that the data, while not fantastical, was modestly compelling, but I'm just as likely to get a tattoo than give steroids for community-acquired pneumonia. I'm just an old fart. Daptomycin was first shown to be effective in bacteremic non-left-sided endocarditis patients in the New England Journal of Medicine. And there's no randomized controlled trials comparing daptomycin to other agents for endocarditis. This just looked at all the patients who got it and the outcomes. The clinical success rate for treating endocarditis was 80%, 91% for right-sided, 76% for left-sided. However, interestingly, at higher doses, 8 milligrams per kilogram, right-sided was cured 91% of the time and left-sided 89% of the time. This is suggestive that if you have a case of endocarditis and you're treating them with daptomycin, that you might strongly consider 8 milligrams per kilogram per day. I'm going to go out on a limb here and suggest that brain abscesses are bad. Now, the key thing about brain abscesses is how difficult they can be to diagnose. And this is brought home from an article out of the Netherlands where they looked at 15 years worth of brain abscesses. And here's the important thing. You're going to miss it. The reason is that only 20% of patients had fever, headache, and nausea. 39%, no fever. 26%, normal CRP. Half, no leukocytosis. And as a result, in the difficulty in making the diagnosis, patients often went a week as the mean in the delay for getting appropriate antibiotics. And brain abscesses are rare. I see one a year maybe. And it's not unusual to have them delayed in diagnosis. They say, oh, you got a brain tumor. And this may come as a surprise, but brain abscesses don't do well when treated with dexamethasone instead of antibiotics. Estrogens evidently increase the risk of staph carriage. This is a general phenomenon where estrogens increase the general ability for pathogens to adhere to mucosal surfaces. And they have found that nasal colonization varies with the menstrual cycle, being highest when the estrogen levels are high and lower when the estrogen levels are low. The consequence of this is that women who are on birth control pills are more likely to carry MRSA and more likely to carry it for prolonged periods of time. This has been documented in several studies, and the particular one I'm talking about, which was in the clinical infectious diseases, estimates that about 20% of persistent nasal carriage in women is probably attributable to hormone therapy. Probably the estrogen component of birth control pills. That's going to be a tough one to reverse. What's worse, pregnancy or MRSA carriage? I'd vote pregnancy. 3 urinary tract infection studies of note. I don't know about you, but we keep going back and forth about using silver pregnated urinary catheters to decrease infections. And catheters go in for either a day, a couple of days, or pretty much forever. We've been working very hard at our institutions basically to never put the catheters in. This study looked at the efficacy of silver-coated catheters in short-term catheterization in England, short-term being 14 days, and it didn't do diddly. So another reason not to use silver-coated catheters. You get the most bang for your buck with Foley's by not putting them in. That's the best way to avoid a urinary tract infections. Over at Science-Based Medicine, Harriet Hall wrote a couple articles on circumcision. And boy, there are a bunch of people out there who are vehement against circumcisions. I mean, it is remarkable that people obsess about this at a level far greater than one would think would be warranted considering all the problems in the world right now. Be that as it may, this is an article that suggests that uncircumcised boys and men have more urinary tract infections. Not much of a surprise there. I'm not saying that's a reason to get a circumcision, because I don't want those people to start writing me letters. I mean, there's something. Actually, I have a doctor in my hospital who doesn't charge for circumcisions. She just takes tips. Thank you. I'll be here all week. How long do you treat urinary tract infections in men? Years ago, I did some antibiotic stewardship at one of my hospitals, and I was amazed that when we looked at all the prescriptions used for UTI in women, nobody got the same prescription more than once. Everybody got treated with a unique type and duration and dosage of oral antibiotics for UTIs. I mean, it amazes me sometimes that something that we know how to treat, outpatient cystitis in young women, people still can't figure out what the dose and duration of antibiotics is. Drives me nuts. This study looked at the VA and how long patients, predominantly male, all male actually, should get treated for their urinary tract infections. The range of antibiotic duration, and you have to snicker when you see this, was between 1 and 173 days. 173 days. But they found that less than 7 days did not have any worse outcomes than longer treatment. But if you had longer courses of therapy, there was a higher chance of late recurrence. Why would that be? You know, there's this interesting article a couple months ago that showed that the bladder is not sterile, that if you use 16S ribosome testing, you find a variety of organisms naturally live in the bladder. I would hypothesize that by treating urinary tract infections longer, you whack the normal flora, and as a consequence, give more binding sites for pathogenic bacteria. Shorter is always better, and probably less than 7 days for the treatment of male UTIs is a valid duration. There was a tornado in Joplin, Missouri, or perhaps Joplin, Missouri in this case, and 13 people came down with cutaneous mucor associated with trauma secondary to the tornado. And 38% of the people who developed cutaneous mucor died. It was a necrotizing infection associated with lots of contaminated wounds. The specific mold of the mucor was Apophysomyces, Apophyssomyces, trapeziformis, Trapeziformis, spells the very best chocolate. I'm sure that's going to show up on my boards. The only question is, I'm going to be able to remember Apophysomyces trapeziformis. Mucor. And finally, I'm shocked to find gambling going on here. The Cochrane reviews looked at the effect of company sponsorship on outcomes in drug or device studies. And big surprise, if it was company sponsored, they were more likely to report favorable results. I'm shocked. Water is wet, fire is hot. People are biased. Now, people look at this and go, well, of course, you can't trust those studies. But I would point out that if you spend your time in the scam literature, SCAM is the acronym for Supplements, Complementary, and Alternative Medicine. You'll find virtually all the studies are done by people who have a dog in the fight to show that their particular scam should be effective. Bias is rampant. You have to take that into consideration when you look at any clinical trial. And it doesn't necessarily invalidate a trial, but it certainly makes the results usually more robust than would occur if there was no bias by the people doing this study. And bias, as Ioannidis points out in his great article on why most of the medical literature is wrong, or most of the scientific literature is wrong, is more than just financial bias. But that ends this particular Puscast. Don't forget my website, edgydoc.com, where you will find my growing multimedia empire of books, apps, podcasts, and blogs, all done by an emotionally immature, arrogant, juvenile, hateful, left-wing extremist who won't grow up. Thank you, FUO Doc. I think that's going to be my new signature on email. Otherwise, thank you for this most interesting consultation and allowing me to participate in the care of this most difficult and challenging case. I shall continue to follow along with you. Thank you. In dictation. Goodbye.